Hello everyone, welcome back to my YouTube channel 𝙦𝙪𝙚𝙾𝙤. So today we are going to discuss about the March month CPC case study questions. In CPC examination, case study questions are very challenging and also it develop your skills and critical thinking. So let's start our video. Okay, let me check the first question. Before that, the question is too long. I'm not reading the complete question. Okay, I'm just reading the important points. Okay. In this question, the procedure is performed Uvulopalatopharyngoplasty. This was the procedure performed. And the main indication is a 63-year-old with obstructive sleep apnea. Okay. So, obstructive sleep apnea is the diagnosis of a 63-year-old patient. Okay. So, just go through the options first. Option A, the code is 42145. Okay. So let me check the code 42145. Yes. Okay. The code means it's for palatopharyngoplasty or example uvulopalatopharyngoplasty or uvuloparyngoplasty. Okay. So yes, the code is right. Okay. Here our procedure is uvulopalatopharyngoplasty. So the first code is right. Okay. So 42145 is the right. And the secondary code is G47.33. Okay, let me check the code. G47.33 is for obstructive sleep apnea. Yes, obstructive sleep apnea. So this was the diagnosis mentioned in the above question. So this was the right answer. The right answer is option A. Okay, the second one, the diagnosis was acute renal failure. Okay, and the procedure is a left subclavian vas catheter placement insertion. Okay, it's an insertion related question. So you just go through the question. Okay, let me check the options first. In the four options, option B, C, D have the secondary code N17.9. It's the same code. Okay, so let me check first the N17.9 code. N17.9 for acute kidney failure. So yes, in our question the diagnosis was acute renal failure. So the secondary code is right. So we have to eliminate option A because in the option A the secondary code was N18.9 is for chronic renal failure. So not the right code. So we have to eliminate option A. Option B, C, D is secondary codes are same but the primary code was different. So let me check the primary code. Okay. Option B 36569. 36569. Okay, let me check the code. This is for insertion of peripherally inserted central venous catheter. So PICC related, but in our question PICC related are not mentioned. So we have to eliminate the option B. And option C 36556. Okay, just go through the code. 36556 is for insertion of non-tunneled centrally inserted central venous catheter age 5 year or older. Yes, this was the right answer. Okay, so option C is the right answer. Option D, just check through the option D. 36580. This is for replacement. Okay, so here there was no replacement was mentioned. So the right answer is option C. Okay, next one is the third question. A 59-year-old male has been diagnosed with left heart failure. Okay, so in this question, left heart failure is the diagnosis. Okay, he currently has a dual system implantable defibrillator. He presents at the outpatient hospital for placement of a cardiac resynchronization therapy device. Okay, here the procedure was performed, placement of cardiac resynchronization therapy device, also known as biventricular pacing. Okay. So this was the procedure performed in this question. So let me check the options first. In this option B and C are the primary codes are same, 33225. Okay, let me check the first 33225. This is an add-on code. Okay, so Option B and C is, there is no doubt B and C are wrong because add-on code should be not a primary code. Okay, so B and C are eliminated, and final option A and D are included. So let me check the option A, 33224. Okay, 33224 is for insertion of pacing electrode. Okay, cardiac venous system for left ventricular pacing. Yes. With attachment to previously placed pacemaker, implantable defibrillator, pulse generator, including revision of pocket removal and insertion replacement of existing generator. Okay. So this was the right answer, but let us check the option D. Okay. 33264 is for removal of implantable defibrillator. So that's the wrong answer. Here the procedure was placement. Okay, so procedure is a placement of cardiac resynchronization therapy. So the right answer is option A. Next question. In this question, malignant neoplasm glottis is the procedure. Sorry, this is the diagnosis. Okay, procedure is a trachea is identified in the middle and is created a allow for new breathing passage. A tracheostomy tube. Okay, insertion of tracheostomy is the procedure. So let us check the options first. Here option A, option B and option D secondary codes are same, C32.0. So let us check the first C32.0 code. This is for malignant neoplasm of glottis. Yes, this is the diagnosis, correct diagnosis. So the secondary code, option A and option B and option D, secondary codes are same. So we can eliminate option C. And let me check the option primary code. Option A, 31601. 31601 is for tracheostomy planned younger than 2 years. Younger than 2 years. In this question, the age is not mentioned. Okay, so that was the wrong answer. Here the tracheostomy planned is mentioned, but younger than 2 years age is not mentioned. So that was a wrong answer. And option B, let me check option B, 31603. This is for tracheostomy emergency procedure transtracheal. Okay, transtracheal. This question didn't mention transtracheal related, so also this is a wrong answer. So the right answer is option D. This is for 31600. This is for tracheostomy planned. Yes. Here there is age not mentioned and tracheostomy is confirmed. So option D is the right answer.